What's up, HFF and PHP, and welcome back to my channel. For those of you who are new, my name is Harriet. I am a nocturnal hospitalist nurse practitioner. Been practicing now going on 8 years, so welcome to my channel. As you can see by the title, we are going to discuss ways to accelerate your learning curve. So let's begin by discussing what is a learning curve. So this is for my new grad nurse practitioners and my new grad nurses, right? You guys finished school and now you got your role, but now you're a novice nurse, right? And you're a novice nurse practitioner. So there's a learning curve that you're going to experience. So again, what is a learning curve? It's the rate of a person's progress in gaining experience through new skills. So we know that healthcare providers, nurses, doctors, nurse practitioners, we are all lifelong learners. And what we learn in school, it's just a quarter of what we're going to learn or need to learn when we're practicing. We learn majority of our knowledge at bedside. And thing is, that's when the learning curve comes in, because that learning curve of what you learn in school to what you need to know and catch up with when you're practicing, it could become very steep. And I feel like when I first started 7 years ago, it wasn't, although I was struggling, I don't think it's as bad what you guys are facing today, because we are sicker. We have more comorbidities that we have to, acknowledge and treat. They're just more complex. We may have a patient coming in with shortness of breath. We diagnose them with pneumonia, right? But then they have like underlying COPD exacerbation going on too, right? They have CHF and could be a little bit of fluid overload. So we have to acknowledge and treat that. And they may be an uncontrolled diabetic. So that one patient right there, that's 4 things that we have to focus on and treat, not just treating the pneumonia. Fast forward to today, we are sicker. So again, this video, we're just going to take a little deep dive into ways to accelerate your learning curve, right? Ways to help you reach that top and get more comfortable at practicing as a nurse practitioner and moving from a novice nurse practitioner, becoming an expert at your area. So my first recommendation actually starts while you're in school, and it's your clinical sites. It's your preceptorship and it's your clinical rotations. I don't want you to be that student that's shadowing your preceptor, right? I want you to become hands-on. So this is your time to experience in real life, firsthand, what it is to be a nurse, what it is to be a nurse practitioner. Take advantage of this opportunity. Take advantage of this time, because you have somebody by your side holding your hand. You should be going and assessing patient first. You should be asking to do that first. You should be asking to examine, asking to come up with that diagnosis, or, seeing if your plan of care is right, and just taking advantage of that time, because you have somebody, you're in the atmosphere, you're in a clinical setting, and you just have somebody right there that you could just bounce ideas and learn from. And this gives you the opportunity to see where your weaknesses are at. So now you're nurse practitioners, right? And hopefully you already practice as a registered nurse. I will link a video discussing benefits of working as a nurse before becoming a nurse practitioner. So all your fears of being in a hospital, being at bedside, is gone, because like I said, you already practice as a nurse, right? So now it's like, now you could focus on just the mindset of being a nurse practitioner. So now we're looking at the full clinical picture. It's a different mindset than when you're a registered nurse. And I want you guys to know that and understand that we have to switch that mindset off being at bedside. Yes, your experience will benefit you, but your thinking process is totally different now. And when you're precepting, it's a learning experience. So don't be afraid to ask and, become hands-on, and being the first to do the exam, the first to become up with a clinical diagnosis. For my preceptors, we've been there before. We experienced the learning curve. We know the fears. We know how it could be uncomfortable. So as preceptors, we need to be open and understanding that they're not, going to know everything. And we don't want to drill them. We don't want to drill them to make the experience, more fearful than it is, or more uncomfortable. We want to ask questions to get them critically thinking, but we don't want to be too overbearing and too hard on them. Don't take it too easy. You guys know what I mean. And I'm sure some of you have experienced those hardcore preceptors. It could be a better teaching opportunity and not always the stern, hardcore drilling. Although that type of technique helps, but at least in the beginning, let's take it easy on the students. But yeah, so number 1 is just taking advantage of your preceptorship, knowing where you want to end up practicing, try to get clinical sites at those locations and becoming hands-on. So number 2 is getting involved in like your fellowship program and residency programs that your job offers. Fellowship programs provides opportunities for nurse practitioners to specialize beyond their graduate school concentration. They're gaining experience working within a subspecialty. Examples could be like GI subspecialty, nephrology, cardiac, oncology. Residency program is a postgraduate program for NPs who want to gain more clinical experience within their field. It's not necessarily as specialized as a fellowship program, but they do allow the nurse practitioner to sharpen their skills. Although fellowship programs and residency programs are different, but both are a way for NPs to carry out their initial clinical experience in a supervised postgraduate professional setting. So yeah, it's like a paid clinical rotation. I know the pay is a little bit less than if you were practicing on your own. I know seats are limited in these programs, but man, if you have the opportunity, take advantage of it. So the third way to accelerate your learning curve is having a mentor or just having other collaborating close nurse practitioners, doctors, physician assistants, somebody you could easily call at any time. If you know you are going to become a hospice nurse practitioner, I recommend just trying to find a mentor while you're in school, just so they could help you ease and have a better transition and just get you squared away before practicing. But going back to like just having a close nurse practitioner, if you don't have a mentor, just having someone who's close. You know, when you're in school, you make friends and you have that 1 or 2 good friends throughout graduate school. Keep their numbers, have them on speed dial, having somebody just close by just to bounce ideas, or if you have any questions, sometimes you're so overwhelmed you don't have time to look things up. Hey, text them. Till this day, I am still phoning a friend. Yeah, being able to phone a friend whenever you can is so helpful. Number 4 is continuing to educate yourself and keeping your school notes. Do not throw away your school notes. I think my first 2 years I did refer back to my notes here and there, not all the time, but don't give them away. Just have them still in arm's reach. When I first started my position, I was given like a list of the common diagnoses that I will have to admit. So what did I do? I took each of those common diagnoses, wrote a basic workup that I could always refer to. If they're AFib, we got to know what their CHA2DS2-VASc score. Are they on Coumadin? What's their INR? What's the INR goal? Like just simple things I wrote that I could always refer to. And I always recommend a little pocket notebook, write things down. And like I said, you're still going to be doing some work. It doesn't stop. Remember, we're lifelong learners. So even when you're home, like, you could create your own list of the common diagnoses that you even already seen, like the pneumonias, the COPD exacerbation, and just the common workups and treatment plans that you may need. Keeping it in a notebook, always by your side, and just continuing to add to it. Number 5 is be nosy and ask questions. If you're not familiar with doctor's workroom, it's like one big workroom with maybe it could be 8 to 10 or even more computers, and every computer there's a doctor sitting, and doctors, they're talking amongst each other. They're talking on the phone with consult teams. When I tell you I was so nosy, I had my notebook out. Whatever they were talking about, whatever, again, disease, process, illnesses they were talking about, I was writing things down. I will literally include myself in their conversation. I will make eye contact. And that's another thing, which I would create a video about, becoming confident when you're collaborating and, working with these doctors. But I will make eye contact. I will show them that I want to learn. I show them that I'm interested. I will engage in that conversation. Although it wasn't with me, I will engage myself, because you have to show them too, especially being a novice nurse practitioner, we have to show them and prove to them that we want it. And I feel like that's what helped me in the beginning, because to be honest, I was told Harriet, you're an amazing nurse practitioner, but you don't know what to write in these notes. And I didn't. We didn't really talk about, writing H&Ps. And a nurse practitioner that I followed for my clinical rotation, she didn't admit patients. So with this job, doing admission and writing H&Ps were totally new for me. These doctors love to learn, and they love to teach too. Don't be afraid to ask questions. So you know that phrase when we were younger growing up, there's no such thing as a dumb or stupid question. Especially when it comes to healthcare, we want to learn. We're lifelong learners. So anything that we could expand our knowledge with, write it down. Write it down. We are trying to grow. We are trying to improve. We are trying to transition from a novice nurse practitioner to becoming an expert in our area. A lot of new NPs may feel or experience what it's called imposter syndrome, feeling that they don't know anything, and then which leads to anxiety and just becoming more fearful. The anxiety and worries, we have to give it to the Lord. We have to give it to Him. We have to give it to the Lord. and be there, be present, because that fear, anxiety, and worry, that's going to make the situation worse. We could talk about imposter syndrome in another video, but again, no question is a dumb, stupid question. Be nosy and show that you want to learn. So those are 5 things that I recommend to help you accelerate your learning curve. And like I said, nowadays, becoming a new nurse practitioner, I give you guys props. Especially a hospice nurse practitioner, because that learning curve is a lot steeper nowadays. If any of you NP students out there right now who see yourself becoming a hospice nurse practitioner, start now. Start reaching out and seeking mentorship. Start searching for fellowship residency programs. Because I had several NPs who reached out to me and it was too late. It was too late and they are now seeking other employment. We have to humble ourselves. Nurses that have like 15, 20 years under your belt and then you go back and become a nurse practitioner. Yes, you have all that experience under your belt, but when you becoming a nurse practitioner, especially if it's another area of specialty than where you were working as a nurse, it's like you have to humble yourself, take a couple steps back because you're no longer an expert, right? You're now a novice nurse practitioner. And that's just reality. We have to humble ourselves and know that, and we have to understand and change our mindset in the beginning and acknowledge that there is going to be a learning curve. The mindset that you had as a nurse, it's not the same. It's not the same. We're now providers, so definitely have to keep that in mind. Nearing the end of this video, you guys know I love to end my videos with a Bible verse, and today I have a special guest with me. She's always with me. My daughter, she wanted to say the Bible verse today, so this is my baby girl, Ivana, and today's Bible verse is what?
Joshua chapter 1 verse 9. Have I not commanded you? Be strong and courageous. Do not be afraid. Do not be discouraged, for your Lord your God will be with you wherever you go.
Do not be afraid. Do not be discouraged. I want you to have faith in the Lord. Believe in Him. He's going to be with you wherever you go. He is that mentorship that you need. When you start out as a nurse practitioner, you're going to be afraid. You're going to be anxious. He's telling you, don't be discouraged. Don't be afraid. He's going to be with you. He's going to be holding your hand. But you have to have faith in Him. You have to have faith and believe in Him. That should conclude this video. Until next time.